Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Today, we are going to be talking all about Patellofemoral Pain Syndrome, or sometimes referred to as PFPS, and how it affects dancers specifically. You'll sometimes also hear this condition called runner's knee. I don't hear that terminology as much as maybe previously, but if you have kind of heard that term before, that is the same thing that we are going to be talking about today. So, what is PFPS, or Patellofemoral Pain Syndrome? It is essentially pain that occurs in the anterior part of the knee, so the front of the knee, in and around the kneecap. And it can encompass a few different things that are going on, but generally the pain is going to be sort of on the inner side or anywhere really surrounding the kneecap. Some people will really describe the pain as occurring like underneath the kneecap, but pain that's happening in the front part of the knee. PFPS is one of the most common knee injuries, or one of the most common causes of knee pain that we see. So in the general population, the incidence is like approximately 25% of people with knee pain are dealing with patellofemoral pain syndrome. And in a dance population, and specifically in one study that looked at dancers between the ages of 11 and 16, so that kind of adolescent dancers, they were finding rates of sort of between 30 and 36% of dancers were experiencing some or had experienced some sort of anterior knee pain that could be classified as this. So it is quite a common knee issue. And it is probably the most common knee issue that I see clinically in the clinic. So again, I deal with a lot of adolescent dancers. That does make up probably the majority of my caseload. And so people coming in with knee pain, this is by far the most common cause of knee pain that I'm seeing in these adolescent dancers. So how do we diagnose it, or what are we looking for when people come in and they're sort of like talking about, oh, I have pain in the knee? Some of the like really common signs and symptoms of it being a patellofemoral pain issue are pain, like I said, in and around the kneecap or sort of maybe underneath the kneecap, especially with loaded activities. So in dance, dancers are going to come in and they're going to say, oh, when I do a grand plie or when I'm landing from jumps and things like that, that is when they're getting the pain. And a lot of dancers, depending on how long they wait to access treatment, if they come in fairly soon after onset of it, a lot of times they won't even feel it if they're loading through both legs. So say they're doing a grand plie with both legs, so in first position or something like that. But if they're doing single leg loaded activities, that's when they'll feel it. So it's maybe not so severe, so significant that they feel it when the load is distributed between both sides. But as soon as they're loading on one leg in a fondue, for instance, that is when they're going to feel the pain in the knee. So it's often with those loaded activities. And oftentimes people will also describe pain or experience pain with prolonged sitting activities. So again, because we see it really commonly in the adolescent population, it'll be dancers who say, do you know what, my knee actually hurts more at school than it does while I'm dancing. So when I'm sitting at my desk and I have to have my knee bent for a long period of time, it starts to get really, really sore. And this is really common. We often term this like movie theater knee. Like that's kind of like what you'll sometimes hear it referred to in the medical community. And it's just that idea that if you have to sit with your knees bent up for a prolonged period of time, that will often be a really aggravating thing for people who are experiencing patellofemoral pain syndrome. People will often describe, or you'll be able to like see or feel, or I guess hear or feel, maybe not see, like clicking or popping or grinding, or people will describe like a rubbing sort of sensation. So there's usually some sort of a sensation like that they will be able to kind of notice or feel. And a lot of times the dancers are just saying, oh yeah, my knee's been like clicking a lot more than normal, or it started to click and I started to notice that. Sometimes we're going to have people who actually experience swelling in the knee as well. So I'll just describe a little bit the mechanism of how this happens in a second. But if we, again, don't catch these early and they get to a little bit more of a like moderate or severe kind of like severity of the injury, then oftentimes we will see swelling in and around the kneecap area as well. That doesn't always happen. A lot of times with this, physically, the knee looks fine. There isn't, swelling and bruising and things like that. It sort of looks quote unquote normal. But when we actually then start to look at like the function, this turns out to be the diagnosis of this sort of patellofemoral pain syndrome. More often than not, so in the vast majority of people who have this issue, it comes on gradually. So it's what we would consider like an insidious onset. There isn't one specific thing that caused it to happen. It's slowly over time, people notice that their knee has started to get sore, and it usually does get progressively more sore. So if we ignore it and don't do anything about it, it will progress in intensity and severity, but it usually is a gradual onset. There are some instances where this will occur after an acute injury and be a result of something else that's happened in the knee. And so where we see this sometimes is if somebody, say, has an injury to one of the ligaments, like either they have potentially an ACL in a really severe case, but even like an MCL injury or something that's a more acute traumatic injury. And in the course of that injury recovering and healing, they may develop patellofemoral pain syndrome as one of the sort of consequences or as a compensation of that original injury. So we do sometimes see it occurring acutely subsequent to another injury in and around the knee, but more often than not, this is a gradual onset injury that doesn't necessarily have a super obvious cause. It's not, somebody landed from a jump, felt a pain in their knee, and then that's what this diagnosis is. This is almost always the people who are like, oh, my knee's just starting to get a little bit sore and then progressively gets more sore. So when we think about I guess I'll talk about the mechanism of basically what is actually happening or what is usually happening. And this kind of ties into sort of like the causes of it. But essentially our kneecap or our patella sits in a little groove on the front of our femur. So our femur is like our thigh bone. And so where it joins into the knee joint, there's a little groove in the front. And the patella should sit fairly snugly, like right in that little groove. And the underneath side of the kneecap and then the little groove on the femur both have fairly smooth cartilage covering those surfaces. And when we bend and straighten our knee, the patella moves, or it slides, glides, whatever you want to call it, up and down in that little groove. And because there's cartilage and smooth cartilage, it should glide really smoothly and it should feel totally fine. What happens in patellofemoral pain syndrome is something, and we'll talk about that in a second, makes the kneecap not glide or slide really smoothly in that little groove. And so one of the most common reasons we'll see that has to do with muscle imbalances sort of surrounding the area. And instead of the kneecap being able to slide like sort of straight up and down and sit in that little groove, it may get pulled one direction or another. So maybe it gets pulled more towards one side of the little groove, or, it becomes a little bit misaligned, we'll say. I don't know if I love that word, but it's not gliding smoothly. And when that happens, we may actually get parts of the joint surfaces that don't have as much of the smooth cartilage. So around the edges, there isn't as much cartilage. We might get those rubbing against each other. Or we may just have, parts of the joint surfaces contacting each other that don't normally contact each other. And that can cause that pain and discomfort, and may also be what's causing clicking or that rubbing sensation or things like that. That is also why when this gets worse, we will often see swelling associated with it, whereas in the beginning we may not, because if it's rubbing a little bit, to begin with, and it hasn't been going on for very long, we probably don't have a swelling response at that point in time. But if that continues to rub and you're continuing to do repetitive movements over and over and over and over again, over time, that can cause like more friction and can create swelling in the area. So sometimes when these get worse, we can see some pretty significant amounts of swelling. So that's kind of the mechanism of what's happening, is the kneecap not necessarily being able to, we call it tracking, but track properly in the little groove in the front of the leg. And so there can be all sorts of reasons why this happens. And most of them actually aren't local to the knee itself. Most of them are things that are going on somewhere else within what we call the kinetic chain. So somewhere either below the knee, above the knee, kind of in how the body is moving as a whole, that's causing that sort of malalignment, or whatever we want to call it, in the tracking in the kneecap. So we can have these muscle imbalances that are created for a variety of reasons. And probably the most common ones that I see in dancers are adolescent growth spurt. So like I was saying before, in that study of age 11 to 16-year-olds, it's like 36% of people are going to experience some sort of an anterior knee pain. When we're going through rapid periods of growth in the adolescent growth spurt, it's really common to develop some muscle imbalances. And whether that is weakness developing in muscles in and around the knee, whether that's weakness developing in muscles in and around the core or the pelvic girdle or other areas, or it can be tightnesses that are developing as well. So if you've gone through a super rapid growth spurt and maybe the thigh bone has lengthened really quickly, but the quad muscles haven't been able to keep pace and they haven't sort of lengthened yet, excuse me, that may also contribute to these muscle imbalances. So it's not always a weakness, it's not always a tightness, and sometimes it is a combination of both of those things that can contribute to this patellofemoral pain syndrome. Specifically in dance, we see some of these imbalances develop, not just in people going through an adolescent growth spurt, but just in dancers in general, from working a lot in external rotation positions. So because we spend so much of our time in turnout, it is quite common that we may see some imbalances develop where oftentimes muscles around the hip and pelvic girdle might not be working as hard as they should. Maybe muscles in and around the outer quad area, so the lateral quad, might get tighter than they should be. So we can see these imbalances develop just from repetitive movement activities. And in dance, that seems to be working in turnout that maybe predisposes dancers to, or I shouldn't say predisposes, but makes it a little bit more likely that dancers might develop this type of an anterior knee pain syndrome. Some other things that can be causes of patellofemoral pain syndrome are just overtraining or sudden changes in training load. And so we've talked about this before on the podcast in regards to other injuries and things like that. But anytime we have sort of periods of overtraining where the body's not able to recover adequately between sessions, we will potentially see kind of imbalances develop or see compensation patterns that develop as a result of that. And so that's a common time when we'll see this develop as dancers, especially I see it often after summer when dancers are first returning to dance at the start of a new dance season. This is definitely one of the complaints that we'll often see dancers coming into the clinic with, is this patellofemoral pain syndrome as they're getting back into dance and have had this kind of sudden change in training load. We also, in dance, spend so much time doing repeated loading of the knee joint. So if we think about the landing of jumps in dance, or even if you think about styles like, say, hip hop or something like that, we may not actually be jumping, but there's that repeated loading into knee bending, and we call it eccentric loading. So it's that idea of slowing down as we're landing, which is what's happening when we're landing from a jump, but it can happen with other movement patterns in certain dance styles as well. And this can definitely be a contributing factor to people developing this anterior knee pain, is that sort of of eccentric landing or repeated loading. And especially if people are doing that repetitively with suboptimal mechanics. And so one of the things that we look at a lot in people coming in with patellofemoral knee pain is what are the mechanics of their lower extremity when they are, going into a knee bending movement, whether that be a squat or a lunge or a jump landing or a plie or whatever the movement pattern is. We want to know how it is they are landing or absorbing those eccentric forces through the knee, because that can be a huge contributor. Some other things, and this doesn't necessarily have anything to do, well, I shouldn't say that. Other sort of causes or risk factors, we'll call them, for developing patellofemoral pain syndrome are it is more common in females than in males. And so obviously in dance, we have more females participating in dance than male dancers. So again, we just see a higher prevalence of this in the dance population because of that. And then we do see a higher rate of this in sort of teenagers and into like early 20s when they look at this, even in general populations. This is an injury or a syndrome where we do see this most commonly in adolescence into early adulthood. We don't see this as commonly in older adults, although sometimes we do if they're participating in activities like running or something with repetitive loading through the knee. So again, that really just fits our dance population of female-dominated participants and then a lot of dancers going through sort of like teenage years, adolescent growth spurts. So it is unsurprising that we see high rates of patellofemoral knee pain in dancers. So if we have dancers who are dealing with this, what do we want to do in terms of treatment? Like, how do we manage this? What is the treatment for this? And I do want to say that this is, we kind of call it an injury, but because it is more of this, it's like a chronic overuse condition. Essentially, most of the time it's not happening subsequent to an actual acute injury. And so when we're talking about this, it is much more talking about like the management of it, because for some dancers, and I guess one thing that I didn't mention is some people are going to be more predisposed to developing this just based on the shape of their actual knee joint itself, or the shape of their kneecap, like their patella, and how it sits in that little groove in the front, or the size of it. And so there's some things that can kind of predispose people to developing patellofemoral pain syndrome. And in those people, it becomes a question of managing the condition where the things that we're going to talk about in terms of treatment might be things that we have to look at a little bit more long term. It's not always something that we just like treat once, it goes away and it never comes back. That happens in some people for sure, but in some people, and especially maybe our more hypermobile dancers, where they might have a lot of like mobility or even some laxity in and around their kneecap, this might be something that they're kind of working on managing more long term while they're dancing, just because of the nature of dance, how we work in rotation and turnout all the time. We're doing a lot of eccentric loading through our knees, things like that. So when we're talking about treatment, some of it is like we're doing this in the moment, and some of it is like, okay, we might actually need to continue to think about this as long-term sort of treatment. So the biggest thing is we need to address whatever the imbalances are that have occurred to cause this kind of tracking issue in the kneecap. And so in most dancers, I will say the imbalances that we see most commonly happen from above the knee. So we're often looking at potentially core. Maybe there's weaknesses in the core. Maybe there is lack of stability or lack of control coming through there. But most commonly, I would say it's sort of pelvic girdle and hip that we're looking at addressing in dancers. In the general population, when we see this condition, I would say I see more people where the issue may be coming from lower down in the kinetic chain. So maybe more foot and ankle control issues contributing to knee pain. And certainly that can be the case in dancers as well. But in the dance population, and again, this likely has something to do with the fact that we're in turnout so often. And so that's coming sort of from the hip and the musculature around the hip. I will say more often than not in dancers, we're addressing muscle imbalances and issues coming from the hip as opposed to coming from the lower extremity. And the ones that I see most commonly in dancers are weaknesses in glute muscles. And I think for a really long time, everyone was like, oh, all knee pain is coming from weakness in glute med. And so if you go do clamshells, it's going to solve all your knee pain problems. And that is quite a simplistic approach to things. And more often than not, what I find in the dance population is it's not necessarily a glute med weakness, but it's dancers not using or utilizing their glute max muscle more commonly. And that has a lot to do with the movement patterns that we train in dance, where we spend a lot of time like going into plies or landing from jumps where we keep our torso really upright. But in reality, if we're looking at just fundamental movement patterns like a squat pattern or like a jump, we call it like a broad jump or things like that, there should be movement and an axis occurring around the hip joint. And our glute max should be a big contributor in those movement patterns. And dancers have been trained away from those movement patterns. And so one of the things that we're almost always addressing when we're dealing with anterior knee pain is teaching dancers how to utilize that hip movement and really get their glutes kind of working for them when they are going into like a squat pattern or if they're landing from like a broad jump or something like that. That's not to say that we're going to completely change their landing mechanics in a quote unquote dance jump, because there is an aesthetic required. Like we're not going to say do a saute in first position and then like stick our butt out behind us to get our glutes firing more in that pattern. Like that's not what I'm saying, but we need to have the ability to load into those patterns as part of our like conditioning or cross training. And then when we're actually dancing, we're obviously going to be using like dance technique and dance mechanics. So we want to look at addressing muscle imbalances anywhere within that kinetic chain that's contributing to, the malalignment or the mistracking in the kneecap. More often than not, it is something coming from either above the knee joint or below the knee joint, and not necessarily from the knee joint itself. This was like years ago, but there used to be some like kind of like almost like hyperfixation on people trying to get the VMO, the vastus medialis. It's the innermost part of your quad muscle above your kneecap, trying to get that to fire. And everyone was like, oh, everybody's knee pain is coming because their vastus medialis isn't firing properly. So people used to really specifically work on trying to get like that one tiny bit of your quad muscle firing, when in reality, this is like a much bigger global picture where we really need to look at like how well is the entire lower kinetic chain functioning. So we're going to look at control and mobility through the foot, through the ankle, through the hip, through the pelvic girdle, all of those areas. And then, like I said, so oftentimes we're addressing the weaknesses, and then sometimes we're addressing tightness or length issues as well. That I would say is less common, but certainly in the case of adolescent growth spurt, we may be addressing length issues to address the kind of patellar mobility problems. We want to look at how dancers are accessing and utilizing their turnout. So like I said, I think we see a higher incidence of this in dancers, or we see it commonly in dancers because of how much time we spend in turnout. And I see more issues with anterior knee pain in dancers who are maybe not accessing their turnout super efficiently. And so this can happen in a few different ways. One of the things we see really commonly in dancers who are kind of forcing their turnout from the feet because they're not accessing or holding it properly through the turnout muscles in the hip, like their deep hip rotator muscles. And so we'll see them over turn out from their feet, which causes this torque to happen like at the knee joint itself. So we really want to make sure we're looking at how dancers are accessing turnout, holding their turnout, what muscles they're utilizing and using for their turnout. And then the other sort of population, so those are dancers who are maybe like kind of cheating their turnout a little bit or forcing it from their feet. And then the other group of dancers that I see often experiencing anterior knee pain are dancers who, again, maybe not utilizing those deep turnout muscles very efficiently, and they tend to overcompensate by just like squeezing their butt really hard. And so they're actually using that like glute max muscle, but not in the way we want them to be using it. They're trying to use it to hold their turnout, and that in turn can create some imbalances in and around like the hip that then sort of spirals down the chain into the knee and can cause this anterior knee issue. So one of the things we're always going to be looking at in dancers with anterior knee pain is how are they accessing and controlling and utilizing their turnout, and is that potentially contributing to it? We then are going to look at how they're loading, or the mechanics of what we're looking at. So sometimes dancers, when we actually look at, okay, how strong are their muscles, muscle length, we look at those things individually, everything seems fine. But when we then get them up and are looking at functional movements or the mechanics of how they're moving, there may be something that's happening there. And the thing that we see most commonly is dancers who are, when they're landing, so if the dancer is in parallel, so their toes are facing forwards, when they're landing from a jump or even doing like a single leg knee bend, they struggle to maintain alignment of the knee tracking forwards over sort of like we aim for, second to third toe in through there. And oftentimes what we'll see is the knee will drop inwards and it will come inside of the big toe or inside of the foot. And we call that a knee valgus position. And that's one of the most common sort of mechanical issues that we see happening with these patellofemoral pain syndromes. And so oftentimes we are looking at correcting those biomechanics or correcting the mechanics of the lower extremity, whether that be with a plie, with a squat, with a jump landing. We're going to look at correcting that. And that then goes hand in hand with looking at technical corrections or technique corrections within their dance movement. So we're always going to start by looking at foundational movements and just functional movement patterns, but then I'm going to look at it specifically with their dance movements as well. So I'm not just going to look at a squat, I'm also going to look at a plie. And if there are movements that we know are the most irritating to them, and oftentimes it'll be like a grand plie in fifth position, specifically with the like sore knee as their back foot, or that's just an example. That's not necessarily what we always see, but we want to make sure that we're looking at all of their dance-specific movements, because oftentimes there can be something technically going on with that that may be contributing to the knee pain as well. So we're going to look at addressing muscle imbalances in the whole lower kinetic chain. We're looking at addressing their turnout or just making sure that they are using their turnout efficiently. We want to look at technique corrections. And then we also want to look really closely at load management issues. So like I said, this injury or sort of pain syndrome comes a lot from overloading or sudden changes in load. And so sometimes all we need to do is change some of their loading management. And even if this issue didn't arise from a sudden change in load and things like that, one of the things we're doing with management is often load management anyway. And so the most common way we're doing that is reducing how much loaded knee flexion they're doing. So whether that is, making them not jump for a period of time, or limiting how much they're jumping in class for a period of time, or in the case of dance styles where maybe there's not so much jumping, but there's just a lot of loaded knee flexion, like I'm thinking of like hip hoppy type styles and things like that, we may need to limit some of those irritating movements. In some dancers, it might be, okay, we don't want you doing full knee flexion. So things like grand plies or a lot of like squatting all the way down to the ground or crouching and contemporary work. There's a lot of like getting up and down off the ground. And so sometimes we need to limit that type of thing more so than actually jumping itself. So it really depends on the presentation and what the underlying kind of root cause is for the patellofemoral pain syndrome. But we want to make sure that we are addressing load management issues and modifying that as needed so that they can ideally still participate in as much dance as possible, but not continue to kind of flare up the issue. And so we can address the issue while maintaining as much dance as possible. And then one of the other things that we will often look at is external supports for the knee. So taping is a really common thing that you will see with these types of knee issues. And taping can be really, really effective because, like we talked about before, this issue generally arises from a tracking issue with the kneecap, and we can use tape to influence the tracking of the kneecap. And so sometimes we're using more what we call like rigid strapping tape. So it's, I use Leukotape a lot for this. It's a really strong, super sticky type of tape, and to actually kind of like reposition the kneecap. So it's like a stronger, it's not a stretchy tape. So you can use it to influence like the more static position of the kneecap. And especially when these are in their more acute stage, or if they are more painful, that can be super, super helpful. And then you'll also see a lot of people using the more stretchy types of tapes, like KT tape or any of like the kinesiology tapes. And those ones aren't necessarily going to influence the position of the kneecap as much because they are stretchy and they're just not like rigid and holding things in place. But they can be really useful in changing the sort of neuromuscular input or the proprioceptive input into the muscles and in surrounding the knee joint. And that can actually really help with the tracking as well. So it's not always like a physical correction that we're looking for. Sometimes it is more of like that proprioceptive neuromuscular input just to help with the mechanics as we're, re-educating some of those muscle patterns and things like that. So those are really great options and super effective oftentimes for these types of knee issues. In some cases, if people can't tolerate tape on their skin, so if people react and have rashes and things like that, and there are some people that do, or it is a longer standing, more chronic issue where just taping repetitively for, long periods of time is not practical, we will sometimes recommend braces as well. I often get dancers coming into the clinic who, before they've even sought out physio and like come in for an assessment, they've tried using a little kind of knee sleeve or a brace or something. And they'll say, oh yeah, I just like went to the drugstore and got this. And more often than not, they're just those little like kind of compression knee sleeves. And those are not super effective often for this type of knee issue. What we want, if we're going to look at bracing that's going to be effective, is it needs to have a cutout for the actual kneecap itself. So a lot of those sleeves that you pull on, they're just like a solid, they're just compression more than anything. But what we want is a brace that has a like hole in the center where your kneecap kind of fits. And then ideally what we want is that there's little straps that go around that so you can actually work on like positioning the kneecap a little bit. So sometimes these braces are called like patellar stabilizing braces or a patellar tracking brace or things like that. But we need it to be able to control the position of the kneecap a little bit for it to be effective. Just like straight compression is probably not going to be overly effective for these types of knee issues. So bracing is something we consider sometimes. A lot of dancers don't love wearing braces just because they are a little bit more cumbersome. It makes it harder to, get up and down off the floor. Just certain movements, it does restrict your movement a little bit more. So I do find dancers tend to prefer tape, but braces can be a good option if it is a more long-standing issue or there's any sort of skin sensitivity with tape and things like that. One of the other things that we, again, sometimes will use to address these issues, although, like I said, in dancers, I don't see it as commonly being an issue that's coming from the foot. But if somebody has a foot structure and function where they're not able to control, the dynamic control of their foot, then sometimes using an orthotic to help give them a little bit of passive support and a little bit more control through the foot will help with the alignment and with the control through the knee as well. So in dancers, this is not ever sort of my first recommendation necessarily. This might be something that might be more recommended among like runners and other people who are dealing with patellofemoral pain syndrome. But in dancers, like I said, first of all, it often seems like it's coming from higher up the kinetic chain and not so much foot and ankle involvement. But even in the dancers where there is foot and ankle involvement, we cannot generally wear orthotics within dance shoes. And so it doesn't tend to be a really effective treatment strategy. So it is something that you will see recommended sometimes, but I will say in a dance population, it is not something that we're commonly going after when it comes to this type of a knee issue, unless there is a more like structural problem going on, in which case maybe orthotics are warranted. So that's kind of treatment approach. Like I said, the biggest thing is really figuring out the individual person's sort of muscle imbalances that are causing the issue and then addressing those as the underlying cause. And so all too often, I think we see with knee pain where people are trying to just treat it locally and really, deal with the actual knee itself and where the pain is coming from. And so maybe they're just using taping or they're just using a knee brace or things like that. And it doesn't actually solve the issue because the root cause of it is usually coming from somewhere else. And it may be just the mechanics, it might be muscle imbalances, any of those kind of things we talked about. So really making sure we know what the root cause of it is in an individual person, and then addressing that is the key to dealing with these types of syndromes. So hopefully that is helpful to you. Like I said, this is a really common knee condition. I think a lot of dancers get really worried when they have things going on with their knees, more so than other areas of the body, which I always find interesting. I think people, when they have something going on with their knee, tend to jump to like worst case scenario, whereas if they have something going on with their hip or something, they're like, oh yeah, my hip's just sore. But in the great big scheme of things, these knee issues are usually not super serious or super severe. And with sort of correct diagnosis and correct management and addressing the underlying causes, we can usually get a really good handle on them. And dancers do really well. And more often than not, if we catch these early, dancers don't actually even need to take time away from dance. Like I said, we may modify what they're doing from a load management perspective, but they don't usually require, complete rest from dance or anything like that. It really is looking at addressing the underlying issues. So hopefully that is helpful to all of you, whether you're a dancer or a dance teacher or a dance parent or what have you, just to kind of put your mind at ease a little bit, because these are really, really, really common knee issues, but they're also quite addressable if we have a good assessment done and really look at the underlying causes and address those underlying causes. If you have any questions about anything that I talked about in today's podcast episode, please reach out to me. You can reach me at Dance Physio Erika on Instagram or Facebook, and my email address is in the show notes as well. I would love to hear from you. Once again, thank you so much for listening today, and I hope you have a great rest of your day.